Hello, friends. Welcome back to the podcast. I am really excited to share this episode, and I also have a question for you guys who are listening. So first of all, about this episode, this is a sneaky good topic, you guys. So I know I was thinking about it. So the conversation is with an orthodontist, but this feels very Mean Girls coded. He's not just a regular orthodontist. He's a very cool orthodontist. And as someone who had braces twice, I learned a ton in this episode. So if you're like, I'm not really into, orthodontia, it's honestly not about orthodontia. So we go into a lot of different things. We deep dive into teeth whitening, which is so much easier. It's so much less complicated than we make it out to be. Essentially, he, spoiler alert, kind of says, these options, pick any of them, right? It's not what I was expecting. I thought there was going to be a clear winner. We'll dive more into that. There are different things to kind of think about. We also deep dive into teeth sensitivity. That kind of really aligns with whitening, but I learned so much about actually how to prevent teeth sensitivity. But I also learned about different things in your smile. So I think this episode is going to be really interesting to anyone who is how do I kind of improve my smile? Or what I thought was really interesting, if you had braces in the early 2000s, maybe late 90s, anywhere around there, this episode is going to be a little bit of hindsight is 2020, right? You're going to understand why different things happen. You're going to understand why you have the smile that you have. And I don't know, I just thought it was super, super interesting. So a sneaky good episode. We are with Dr. Jeff Heinz. And like I said, he's a very unique orthodontist because he also specializes he's recently joined the American Academy of Facial Aesthetics. So they actually also do Botox and filler in their office. And at first, my first impression was what in the world? I feel like you only hear that from dermatologists, but when he explained it, I was kind of why don't more orthodontists do Botox and filler when he explains how they use it? It can be both a therapeutic thing, but then also an aesthetic thing. So we're going to deep dive into all of that with this episode. And it's just, like I said, super, super interesting topic, like a sneaky one. So excited about that. I have a question for you guys. But first, if you guys do like this episode, as always, please leave a rating or review on this podcast. We would absolutely love to hear from you. And it really just kind of supports the show, us continuing to create and bring more and more people. If you are listening to the extended podcast in the Luli app, if you don't know, we always do a rapid fire Q&A with our guests just as a little bonus in the app. And we have some really good questions here. We talk about a lot in the extended Q&A about different kind of TikTok-y things. So we talk about banana peel teeth whitening, common causes of yellow teeth, what actually is a healthy color for teeth. So a lot of different things. We do a lot of myth busting there, but so if you have the app, hop on over to any platform and leave a rating or review. We would love to hear it. And if you want to get in the app and listen to that extended episode, this is a really good one to do so. You can get a free 7-day trial, so you can hop in there and just listen and explore everything else that we've got in there. If you don't love it, which I think you do, I literally use the app every single day. The habit tracker and morning reflection is my favorite. But if you don't like it, no harm, no foul. So go ahead and give that a go. But now I have a question for you guys. I feel like I'm moving a million miles an hour today. Do you feel that? I think my coffee is kicking in. Okay, my question for you is, when we were getting this episode all ready to go, I thought about, okay, what are the next episodes that we want to do? And I say this every single time, I really love the episodes that we do with routine wellness. So walking through someone's just day in the life. What do they do? What supplements do they take? What are their different little wellness routines that they do? I just think it's so interesting to see, kind of get different ideas on what helps people feel their best. Maybe you decide to take one of them and give it a go, or just to see wow, everyone is truly different, and it's okay if my routine doesn't look like someone else's. So I was thinking about it. I was I really want to schedule a lot of those episodes coming up. But then I listened to this one and I was like, but I also love the expert ones where we're diving more into these topics because I always learn a ton. So I just want to get your take on that. If you could, if you are watching on YouTube, you can comment below. If you are listening on any other platform, whether it's Apple, Spotify, or in the app, shoot us a DM at with Luli on Instagram or post in our community if you have the app and you're part of the community. Let us know what you want to hear more. Are you more into the experts or are you more into the kind of like day in the life routines? Would love to hear your guys' feedback because like I said, I thought for sure, I was like, I really love the day in the life ones, but then I listened to this and I was like, yeah, but I learned a ton. So we can keep doing the combo. We can lean more into one or the other, but would love to hear from you. Okay, without further ado, how about we get our conversation with Jeff going so you can learn a bunch about teeth, how to get your healthiest, prettiest smile that looks like you, not necessarily just all those chiclet teeth. Let's do it.
There used to be this kind of old way of thinking of orthodontics and that this is purely for straight teeth and a beautiful smile. When you start at like the base of the skull and the base of the root of the matter here, right? We all have a jaw joint on either side. Think of like a ball in a socket, a little disc in there. Sometimes people feel clicks and pops and things like that. Sometimes it's nothing. But sometimes that jaw joint can get into disharmony based on your teeth not coming together the right way. Some people, that'll tend to make them grind over time. And then if they don't have pain from their grinding, it's kind of dangerous because they grind away their teeth, don't even know they're doing it, and then come to their dentist in 20 years and are like, hey, I got nubs. What's going on? Other people, sometimes pain will alert them to an issue and then bring them in. When your teeth don't come together the right way, your body has some protective mechanisms. Your ancestors, when they had a problem with their bite, they didn't really have a way to deal with it. Their bodies would grind away, eventually just flatten their teeth to nubs. Well, our body and our technology has evolved a lot. Now we have orthodontics, thank goodness, but our body doesn't know the difference. So you're going to try and grind around on it. It can do a ton of damage to things. In addition to the jaw pain and things that can develop when your teeth aren't functioning the right way, those can fracture teeth or cause other teeth to wear down improperly. And it kind of opens up the can of worms because then you get maybe a filling for something that's as simple as a small cavity. But now your tooth is a little bit compromised, right? And now that you're looking at crowns or root canals or getting teeth replaced, things like that.
This might be a dumb question. Can you explain the difference of like when someone would go to a dentist versus like an orthodontist?
Sometimes a dentist is a bit of like a quarterback of the situation too, right?
Okay.
They go in and triage like, hey, I got a toothache. Okay. Am I going to send you to a root canal doctor, or am I going to do the root canal here, or what do you need? That kind of thing. But when we're talking about orthodontics is a very complex profession. Dentists can do some orthodontics. Sometimes dentists do a good job. Sometimes dentists don't do a great job, to be frank, right? Sometimes it's never malicious, right? You just don't know what they don't know. But then there's the worst version of things, like have you heard of like Smile Direct Club and stuff like that, and Bite or Candid? There's stuff where literally they'll send you a package, you take your own molds of your teeth and send it back to them, and they send you a version of like an Invisalign or clear aligner. Now that has no diagnosis, no treatment plan, no records like x-rays, and that's the Wild West. And that's where I see a lot of our patients get into major, major issues. Now, fortunately, I see a couple patients a month that have been in a bad spot from it, but that is like the worst side of orthodontics.
Interesting. Are those super popular?
It's cheap, way cheaper. They've found a way to be convenient, and so get people. I have a close friend of ours who was a dive instructor. She traveled around all over the place and she didn't have a home base. And I didn't know she was doing this, but she did that strictly because she didn't have any other options. Unfortunately, she almost lost 2 of her teeth because there was such a problem with the way that they were moving her teeth. So worst case scenario there, we were able to get her fixed up and stabilized. But yeah, I mean, there's quite a few people that do it, unfortunately. And there's just no way to really educate the people en masse aside from stuff like this. And you hate to like bash on other companies. That's just not the way I like to operate. But at the same time, I wish there was more awareness. And I wish people would read the fine print when they sign away their teeth before signing up for something like that. You could just get into trouble quick.
Yeah. You do some really cool things in terms of aesthetics in your office. So first, can we talk about teeth whitening? At-home version versus in-office things. Are they equal? Are there certain things that are better than the other?
Sure. There's a lot of lot of different aspects of whitening them. But ultimately, whitening is getting surface stains and sometimes even a little bit deeper staining from your enamel and whitening your teeth. Most teeth come in a little bit more yellow than we'd like. Ultimately, right, there's different versions of things that you can do to whether it's in office, that highest level with the bright, crazy white lights, and then you also have stuff that you can do at home with the little tubes of
Mhm.
gel. And then there's the Crest white strips everyone knows about, right? There's like a carbamide peroxide
Mm.
that has different strengths. And there's also some hydrogen peroxide. How strong you can go generally depends on whether you're at home or in an office. But as you probably experience, I know I do, teeth get sensitive as hell. You get like a zinger where you're like out of time, where you're like, what was
Yes.
that? One of my best friends is a dentist and just put on some really strong stuff. They got this crazy light that's activating it. Well, you can get like 8 or 10 shades sometimes lighter in a
Uh,
day. Well, he legitimately thought that he was gonna have to have a root canal on every one of his teeth. He was so sensitive for like a month. It was brutal.
Right.
Obviously, we don't like to do that, right? I think he went a little bit overboard because he was the dentist doing it on himself. But you gotta be careful with that stuff. And a lot of the stuff is pretty darn good. But like your Crest white strips, could they get you as white as like an in-office whitening? Yeah, maybe, but it's gonna take a long time. And not everyone's that dedicated. And they aren't all that cheap. Stuff that you might buy online or get at a store, it's just going to take a lot
Mm.
longer to get you there. But sometimes a slow ride is good. We make custom trays for people that it's
Mm.
a little bit more malleable of a material. It's not like a traditional retainer, so it's got a little bit of room for that bleach or whatever you want to call it to sit in, and it rests on your teeth. Because if you put it just right in your retainer, sometimes and you put too much in, it'll kind of squeeze out onto your gums and get
Mm.
you irritated.
Mhm.
But there's lots of different versions of it. I go slow and steady. Most people can handle like an hour a day for a bit or half hour for a day until you get to the whiteness that you want. Then you go to a maintenance dose of that once every couple weeks. I do a little bit and like every now and then. Sometimes I get so sensitive from it. I'm like, yeah, screw it. I have a beautiful wife already. I'm all set.
Okay, couple questions. Firstly, is there any downside if you're whitening your teeth and then have that, like, shooting pain? Is
Yeah.
there a downside to just, like, pushing through that?
100%. You could get more and more and more sensitive. I don't know that there's like upper limit where eventually it's like you actually do need root, but it would make you more and more and more sensitive. It's like opening up some of the pores on your teeth, and it can make them even more sensitive. Now, some of that'll go away over time, but if you keep, it's not like you're going to push through and eventually get to a spot where it's like, oh, I can do whatever to these bad
Mhm.
boys. They're bleach white. Slow and steady wins the race there.
Okay.
Work up to it. You get a little sore, dial it back a little bit, do a little more. If you're like me, you probably go in spurts where you whiten more times of the year or
Mhm.
whatever than others. Just be more consistent with it throughout that time, and you'll generally get more and more white there.
Any at-home ones that you like more than others?
It's interesting. So many businesses are getting into, and there's so many different products that it's kind of hard to keep up with.
Mhm.
There are some now that will have like a little bit of a desensitizer in them
Mm.
as well. Which one's the best? Hard to tell. I haven't used them all, to be frank with you, but I'd say use a couple, right? Try them out. It's not super expensive kind of stuff.
Mhm.
And if they work good for you, good. And if you have something at home or you love your Crest white strips, the good old fashioned, just keep rocking those. That's
Mhm.
all good. There's not going to be a lot that you can buy off the shelf that's going to be like way better here or way better there. It's going to be pretty darn similar.
Okay. Cool. Then with in office, is it typically just, like, one treatment, or do you do it in stages like you would
Yeah,
do, like,
you can.
at
So
home?
you can do like Zoom whitening. I think there's a couple other options of them now too. But you go in and you spend an hour, half hour there or whatever it is, and they're you got your cheeks are hard and your teeth are exposed and dry and the stuff on them, and they're activating it with a bright light, white light. That's definitely going to be your quickest process, but again, a little more risk for sensitivity for sure. It all goes away. But, then you have other versions of like gel in aligners or in some trays that we do. And you can dial that up or down. And we have different strengths of the gel. Like someone who gets real sensitive or we know or they tell us, we'll give them this lower strength and tell them to use it for longer, that kind of thing.
Okay. Now, teeth sensitivity. Is there anything else?
Yeah, one of my go-tos, and that works great for a lot of people, is just to use something like a Sensodyne toothpaste, whether it's using it for your regular toothpaste, but also put that into your bleaching trays and use that
Oh.
as well. Because Sensodyne has these little small little particles in them that those pores in your teeth,
Huh?
especially where your roots are and where your enamel stops and where they meet, these little pores that can get opened up when they're cleaned with bleach. It lets cold and sugar and stuff like that in there, which affects those nerves. That's that sensitivity that you're feeling. So those little molecules, those little particles that are in Sensodyne actually plug some of those little tubules up and then help prevent that. There used to be this amazing product called a Sensi strip. They stopped making it, but
Mm.
you used to put the strip right over top of your teeth and where your exposed roots are and then your gums and then, take it off. And it like worked amazing, but I haven't seen anything like that lately. I did just have a friend that recommended something called Remigel, I think it's called. And it's got sounded like a similar version of the same thing. Particles that plug up some of those tubules. You use it over time and it progressively gets you a little bit less sensitive. Lots of people have sensitive teeth, so there's a big market for it. I think there's more and more that's going to come out for sensitive teeth. One of the easiest things is just use some Sensodyne. And
Okay.
on that topic, Sensodyne is a great one to use because it doesn't have any abrasives in it. Anything that's going to be a whitening toothpaste, I would not recommend because that means you need like the bleach in there to sit on your teeth. That whitens. But the toothpaste that you scrub on, the only way that that's actually whitening is with an actual abrasive in there. Now it's super small. Some of them you feel, some of them you don't really feel.
Hmm.
But those abrasives, especially if you get a little recession in an area, it can start to wear down because where your enamel stops and your root starts, right? That gets really, really soft there comparatively. And you get that scrubbing in the wrong way with a whitening toothpaste, and it can cause those sometimes people will get like little gouges in their roots and they get really sensitive. It can actually cause more recession. So I don't really recommend any whitening toothpaste. You don't need anything like that. You want to whiten your teeth, use some bleach, use some white strips, a million different options. Those are your ways to do it. Don't do it with your toothpaste. And it probably made people's teeth a little bit whiter. There's probably a lot of people that had a lot of damage to their teeth because of it too.
Yikes.
But,
Big
it's just
yikes.
like anything.
So with the Sensodyne, you said put it in like in the tray?
Yeah. I mean,
Huh.
simply brushing with it's great,
Yeah.
right? Or brush with it. And I recommend this for a lot of toothpaste, especially if you have some fluoride and, you decrease your risk for cavities. When you're done brushing with it at night, spit it out, but don't rinse it out.
Okay. I've
That
heard
way
that.
yeah, it can sit on your teeth a little bit, and that really helps out. Same thing with Sensodyne. If you have sensitive teeth, spit it out, don't rinse it out, and, some of that will sit on your teeth and just act a little bit longer. But you could your point there, you could also put it in, whether it's your retainer for your orthodontics or and your whitening tray, you could put that in there and let that sit in there too, and,
But
that can
not with the
definitely help out.
bleach, right?
Correct, I do it
Okay.
separate.
Just
Yeah.
separate treatments. Okay. Got it. Okay. Fascinating. Okay. We have got to talk about the fact that you guys do Botox and filler. Now,
Mhm.
I want to talk about this because I was like, I saw that on your website. I was like, wait, like, I understood the Botox. I'm curious more about the filler aspect, but let's start with the Botox and the teeth of it all. Give me the
Yeah.
lowdown.
Yeah, the way we do things is highly aesthetic, right? There's obviously the function there that we're talking about and all that, but we don't do flat smiles and straight teeth.
Hmm.
We want to do smile arcs and big, beautiful smiles. We spend a lot of time on the aesthetics of smiles. So we felt like there's a natural kind of amalgamation here of an aesthetic side of things as well. And my wife, Katie, who's a PA, who really has a passion for that. She spent quite a few years in dermatology and loves Botox and fillers and rejuvenating your skin. She's got me on a whole regimen that I'm embarrassed to admit there. But we wanted to bring that into the practice because sure, there's moms and dads that want to take better care of their skin or, Botox and stuff like that. But there's people that are out there that, would have never seen us before or never came in. And then, there's really no one on the planet that gets as much training in the head and neck as an orthodontist with the muscles and the tendons and joints. It's really, really intricate stuff. So I felt like there's no one that could be
Yeah.
better at it than, with that background of knowledge than me. And when we're setting up someone's smile, like someone who shows too much gums when they smile, there's some things that we can do with the braces and with moving their teeth within their jaws to help with that. But there's also some things that we can do with Botox to make lips less animated. And we can really design your smile around that. It's just an extra tool in my tool bag that has really opened up the way that we can treat. And then, when you get away from the aesthetic side of things and even just on the functional side of things with Botox and other, botulinum toxins,
Hmm.
you have people that we talked about jaw pain and things like that. Some of those people, I've had patients that are so swollen that their face is about, 30% wider than it should be because they're literally, it's like they're in the gym doing curls all day because they're clenching so much. And they're also, wearing down their teeth and have pain. And we'll slowly start to introduce Botox in with them, oftentimes with some orthodontics as well to kind of unlock their bite and get things in a healthier position. And it's slimming their face just as their muscles of mastication or their chewing muscles are starting to slim back down to where they frankly should be. So it's really been a game changer for us. And, it's been fun too. You know, I like learning new stuff, and it's been a very easy addition to the practice because when you have the background knowledge of all the muscles and it's like, "Oh, yeah, she's animating too much here or this and that," or, you know, "They have issues with these muscles." Well, I know right where it's at. Here's the, you know, amount of Botox we put in there. I mean, it doesn't take long, right? And if you know what you're doing and you have the anatomy as your background, it makes it pretty sweet.
When you explain it like that, it does make a lot of sense.
But you know, at the same time, you don't think about it until you get explained that way, right?
Right. Right. Very interesting. I love that.
Filler's generally aesthetics. Now, there are some things like, for example, if you've ever seen someone with like a fair amount of recession and they get like
Mhm.
little black triangles between their teeth where like their gums don't fill in the areas, there are some people that are doing filler in those areas to plump up their gums and get them to fill in. That would be the more like therapeutic side of filler that I'd see. What I really like to work on are the lips to give them this big, broad, beautiful smile. And oftentimes, a lot of our patients really like the feeling of the braces, giving them a little bit of extra lip
Mhm.
support upper and lower. They get real used to that. You
Oh.
take off those, you know, little braces out, and all of a sudden their lips are in a little bit more than they are used to, right? And they're like, "Ugh, I kind of want that back." And I'm like, well, I got you. I like that just a little bit more than natural. I mean, some people want me to dial it up a little bit more, and we do that, of course. But it's nice to just give a little extra, like just recreate what the braces used to be giving. Filler's super fun, but that's another dangerous one. You got to be going to the right person. You got to be doing it with the right techniques because you know, Botox, the worst case scenario is you don't get great results from it. But lip filler and other fillers, if you get someone that doesn't really know what they're doing, there can be major damage from it. That's a little
Yeah.
scarier for sure.
Oh my gosh. I never thought about, like, how braces really can, like, bump out your lips a little bit. Oh,
Yeah.
the smile arc. Can
Yeah.
you explain a little bit of what that is?
Yeah. It's pretty simple. So there's a principle that was developed by prosthodontists, people that reconstruct, you know, face and things like that back in the 1950s. So it's not super new, but hardly anyone practices with it in mind anymore. But there's a couple different aspects of your smile that are really, really key. And then some people would probably think or they could see or know someone that has a really flat smile, especially when they
Mhm.
get out of treatment. They're "Ugh," like it's super straight, but it almost looks kind of denture, right?
Mhm.
Um, and the most important part of your smile is two things. A, that it has an arc to it. So when you go from the back to the front, it's kind of slowly comes down like this, right? Follows down. And what you really like is when you smile, that natural arc of your lower lip, that your teeth follow that. That's most important, right? And then there's also something that's called the cant of your occlusal plane or of your smile, which is how much, if you take a line from your back teeth and follow it on the tips of your teeth, how much it tilts this way.
Okay.
So what you want is for someone to have a slight tilt to their smile like that, and then also for that arc to happen. So, and when you set those two things up right, you can have smiles that are absolute showstoppers. It's really, really unbelievable some of the stuff we're doing. And there's a lot that goes into like how we did it. I was in a 2-year long master's course for it, and it's really changed the way that I practice. But essentially, you'll probably notice when you look at some of our cases, the braces will get progressively more towards the gums as you go from back to front. And what that does, if you think of someone who had a flat smile, right, and you go from a little bit more towards the tips of the teeth and then more towards the gums, I'm going to over exaggerate here, is when that wire flattens out, it
Uh-huh.
brings those front teeth down more than the back teeth. So you develop that really nice smile arc. So that's what we spend a ton of time on. And sometimes you look at the bracket position, your new patients, when they come in, they're like, whoa, why are my braces up there? And I'm like, because I'm not going to give you some flat average smile. We're going to give you something that really makes you stand out. Trust the process, you know, let me get through this. And it looks amazing. So yeah, that's been probably the most fun part of orthodontics for me. I've been practicing for 8 years now. And that's just been over the last 2, 3 years. And it's really, really changed. I mean, we've always had amazing results, right? It's near and dear to me. But now I'm looking at some of the cases we're doing and I'm like, oh my goodness, you are so, so pretty. Look at this. And it just, yeah, it's fun.
Very cool. I feel like I have, like, the chiclet teeth. I had braces in the early 2000s, and I have that, like, straight, flat smile, but I love how, like, you really kind of change the game in terms of, like, we don't all need to have these, like I said, like, these chiclet teeth that are, like, straight across, but, like, giving you your character and, like,
Mhm.
having your, like, unique smile. What is there anything else we missed that's kind of, like, hip new age, like orthodontia?
Yeah. Yeah. A couple things that come to mind. One is the importance of your airway. and total body health, right? We're seeing it everywhere from, 6, 7-year-old kids, sometimes even younger than that, who are snoring, and then adults who are snoring or having airway issues. And there's a large range of ways that we're helping them out. Sometimes it's as simple as an expander or braces and things like that. But when we catch young kids, we can actually bring their upper jaws forward orthopedically, to give them more room in their airways that are, back here, bringing lower jaws forward,
Huh.
sometimes with or without surgeries, adults and things like that. But airway orthodontics and being aware of that has been really interesting. It's this new area of orthodontics that the research is a little bit foggy at times, but then some stuff is pretty well black and white as it should be. And that has been fun being able to help people with, this part of you, you're like, at the end of the day, you're just a dentist, right? But like, I feel like we're actually affecting someone's actual health with
Yeah.
that kind of thing. Like I have a hygienist kid who comes to mind who had his adenoids and tonsils out, which sometimes is all you need, right? When a young kid has airway issues, who's snoring. He was severely apneic, right? Stopping breathing multiple times, every hour, major, issues from it, behaviorally, things like that. They had their adenoids and tonsils out. I think they actually got their adenoids revised and got that out again. And you look at this case and it's like, he doesn't need an expander. He's got enough space for his teeth. You hear anecdotal evidence about, expanders and things like that. And this isn't for everyone, but she felt like she was kind of against a wall. It's like, the doctors have zero other options for us. They've done the nasal sprays, everything else. We've exhausted all options. And I'm like, well, doing an expander here isn't going to hurt him. But as long as you and I are on the same page, like his teeth don't really need it. But like, if we're going to try and affect something else here, let's do it. She was on board, did this expander for, I think he was 6 or 7 years old. I forget exactly. And he's like, went from severely sleep apneic to very, very mild. And I'm like, whoa, it was just
Wow.
this kind of eye opening moment for me. And this isn't a blanket statement. All kids do not need expanders, right? But you have to base what you're doing on symptoms. And having a good team around you, a good ENT to be able to refer to, who is going to actually take out the adenoids and tonsils if needed. Pediatrician who is identifying some of these things, which sometimes is rare. And then a good orthodontist who, if they can identify orthopedic changes that are needed, then they can kind of help with that too. Because we're just finding more kids now than ever that are having major issues there.
Wow.
And
Interesting.
again, it's this new kind of fun area of orthodontics that I love being a part of. I love kids, and it's really life changing when we can help someone breathe.
Hmm.
So that's one of the main things that comes to mind. But orthodontics has been really cool over the last 10, 15 years, honestly. One of the things that we really like to use are miniature implants, are called TADs, temporary anchorage device. It's called. So essentially, when you think of moving teeth, like the laws of physics apply, right? If you had a missing tooth here and I wanted to close the space, we're going to meet in the middle, right? Like you're pulling on both of them. This side wins a little bit, this side wins a little bit, thinking tug of war there, and they meet in the middle. Well, what if I could place a little miniature implant that's removable here, use that to pull instead of these teeth? Now I can just close that space forward. And now the midline stays on to sacrifice other aspects of the teeth to get some of the side effects that I want on other ones. And so those have been really amazing. Again, it's this super small little miniature stainless steel screw that you put a little topical anesthetic on. Like some people get it up on their gums here, some people get it in the back. There's all, off here. Some people get it in the roof of their mouth. It just depends on what you're doing.
Huh.
But you put a little topical anesthetic on there, screw that in. I have videos of it on, I think, our Instagram and our TikTok. And you use it to pull on the teeth, do whatever you need to. Like we treat gummy smiles with that, which we'll show some really cool before and afters here. And then when you're done with it, you just take it out. But
Huh.
it's really changed the game. Like when we talk about gummy smile treatment for someone, they have too much gum display when they're smiling. There's different versions of it and different reasons why it can happen. But it used to be like, you're going to jaw surgery. They'd go in, they'd cut a piece of your top jaw out, wire your back shut together, and that was it. And most people, rightfully so, are like, yeah, I'm good. You know what I mean? But with those temporary anchorage devices or mini screw, now we can place those. Sometimes we place 4, sometimes just 2, and you can pull the teeth up with those. And when the teeth go up, the gums go with them. So you're actually remodeling their upper jaw. And then I mean, when you look at Beth's case that I'm sure you'll show here, there are some amazing, amazing results that we can achieve there. And just stuff that people used to have to go and do $40,000, $50,000 jaw surgeries to accomplish. And now we can do it in an orthodontic office without surgery. So
Interesting.
that's definitely one of my passions too. And has opened up this huge array of things that we can accomplish unsurgically that we never could before.
Very cool. Are there any, like, issues with having a gummy smile in terms of, like, health or, like, gums or anything like that?
Yeah. No, not really, right? Like, the main thing, it would be cosmetic, and
Mhm.
you don't want no gum show, right? You wanna generally, aesthetic principle is 1 to 3 millimeters of gum display at smile. But I do see lots of patients, especially if you're a mouth breather, and some
Hmm.
people are so gummy that they have a hard time getting their lips
No.
together over their teeth, and they mouth breathe a little bit more. If you mouth breathe, your gums are gonna get swollen and puffy, like, really red, irritated, well, hyperplastic, or, and they can grow a little bit extra. So sometimes a patient who has already a gummy smile through that dry mouth process, mouth breathing, things like that, can get more gummy or their gums get actually bigger. That would be a little bit unhealthy for them, I guess. But it's mainly a cosmetic thing. And
Okay.
it depends on the person, right? Some people show a ton of gums and it's gorgeous. And other people show gums. I have patients who show like this, right? They show a bunch of gums on one side and not on the other. So we fix them up. Some people
Interesting.
that don't show enough teeth. So the worst thing that happens is, as you age, this lip gets a little bit more drooped. This comes down a little bit more. And then you think of like a grandma who, when she smiles or talks, all you see are the bottom teeth, right? And that top teeth just start to disappear. So we can do the reverse of a gummy smile
Hmm.
treatment, to where we put those mini screws on the bottom, push those teeth down, and then bring the top teeth down and bring that bone with it. So now all of a sudden you show more teeth and more gum when you smile. So there's both options too. It's kind of the reverse of a gummy smile, which is really amazing too, because that really youthens up someone's smile.
Interesting. Okay, so I have a question. I feel like a lot of people who, if they have like sleep apnea or if they are like a mouth breather and stuff, like a doctor, and again, not to generalize, but for a lot of people, they'll say, okay, just lose weight and that's not necessarily, I am in a thin body. I can have those issues too.
Sure.
And so it's not necessarily going to fix it. If someone were wanting to kind of like analyze their bite, would they just like go right to an orthodontist? Would they go to like an ENT first? Or like what would kind of that like flow look like? Did I ask that? Does that make sense?
Totally. Yeah. One of the best ways, if you're having actual breathing issues, the kind of first step is to do an at-home sleeping test.
Hmm. No.
So there's a little kit they give you, you hook up, and it'll test your sleep apnea score. Now, it's not perfect. It's not like that gold standard of going into a sleep study, but going into a sleep studies kind of sucks,
Yep.
and like it's nice to do as an initial screening tool. And then if there's some data on that, or some other things that you figure out with your doctor, whomever that is, that, raises a couple more flags, then maybe you do that full on sleep study. But yeah, if you have any questions, concerns, like if you think you're not sleeping the right way or not breathing the right way, you got to figure that out, because sleep apnea is tied to a whole litany of things for your whole body health, both
Yeah.
for kids and adults alike. And to your point, not everyone's treatment plan needs to be the same. Someone might need, like, for instance, cool, related it to orthodontics, but some patients have such a bad overbite from their lower jaw being so far back, and as their jaw comes back, it impinges on their airway. So they
Hmm.
might need a surgery to bring that lower jaw forward. You have some people that have both jaws that need to come forward. Or you have some people that, just have excess tissue in areas and maybe their jaws are fine. Then some people, you have a deviated septum or some sort of
Hmm.
issue in their nose, and then an ENT is involved, right? It's such a broad field, right? But the main thing is just identifying it. And then
Hmm.
sometimes it's like whack-a-mole. You got to go into different specialists and see. But yeah, I think an orthodontist is a great starting point for a lot of people. But there might be a case where they come in and it's like,
Hmm.
your airway issues are probably something that someone else might help you with.
Hmm. Okay.
But there are
Makes
also
sense.
dentists that focus a lot on airway things, and there are appliances that they can use to kind of posture your lower jaw forward, which can tend to open up your airway and things like that. So, and some orthodontists do them as well. There's a lot that goes into it. I think the only downside of that kind of situation is that not everyone's aware of the options they have, and some people, frankly, aren't even aware that they have an issue.
Hmm. Yeah. Well, I hope that this episode allows people to think about orthodontics a little bit differently. And I have to say, I feel like like I said, from someone who had braces twice, I feel like I had no idea, honestly, like why I feel like I know so much more now after just having this conversation. It's like
Sure.
hindsight is like 2020 for it all. So
Oh, yeah.
thank you so much for being here and chatting with me today. We're gonna do another Q&A after this, some rapid fire. We're gonna
Perfect.
talk about banana peel teeth whitening, which I'm excited to chat about,
Love
some
it.
more of that charcoal stuff. But where can everyone find you? Like I said, we'll link your website and everything and your social medias. But anything else that you want to say to anyone before we leave, go record another one, or where anyone can find you?
Yeah, Heinz Orthodontics, Heinz spelled just like the ketchup, no relation, unfortunately. Or Jeff Heinz, follow me personally. We put lots of cases up, a little glimpse into our life and what we're doing in the office and out of the office and those kind of things. And then, I love this kind of stuff, right? And so the biggest thing I'd say is that anyone that has questions on these kind of things, ask them, right? That's what we're here
Yeah.
for. And if I'm not answering, I'll get back to you really, really quickly. But yeah, any social media, TikTok especially, we have some YouTube videos that are going on. We're starting to work that up more and more. But yeah, we got lots of information that we're willing and love to share.
Fabulous. Coolest orthodontist around. The award goes to you. Thank you so much for chatting with me. And everyone, like I said, we'll link everything, but we're going to go answer that Q&A.
Let's do it.
Such a good conversation with Dr. Jeff Heinz. Oh my goodness. And like I said, I told you he's like the coolest orthodontist ever, right? If you are looking for any of the photos, be sure to check out the blog post for this. We have them all there if you would like to take a look at kind of the things that he was talking about. It is really interesting. The smile arc and the, I forget what he calls it, the angle of your teeth, something that I had never thought of. And as having had braces in the early 2000s, it was kind of like I do think people are now leaning more into the natural characteristics of people's teeth and really making your smile yours, not necessarily this like cookie cutter mold. Not that there's anything wrong with it. I honestly kind of feel like I have some of that cookie cutter mold going on with mine because of, like I said, when I had the braces. And sometimes I wonder, okay, if I had braces now, what would that look like? Speaking of braces, if you are looking into having braces now, I was honestly floored that he was like, and it makes sense once we kind of like went through everything, the like mail in fixes. Like it makes so much sense. And hearing that someone almost lost two teeth, maybe this can help give you a little bit of direction. But very, very kind man there. So if you have any questions, we will put his information below. Check out their website if you have any questions about any of the things, or YouTube. We'll link to all of that for you guys. But thank you so much for tuning into another episode. And as always, leave a rating, review, whatever platform you are on. Give the YouTube channel a follow if you are watching there. But thank you so much for tuning in for another episode. Remember, send us a DM or post in the community. Leave a comment on which ones you would like to hear more of the interview or more of the day in the life kind of routine wellness ones. We would love to hear from you as we are doing some more planning. But with that, go have a lovely, lovely rest of your day. Show that smile. Do something today to make someone else smile. And we'll see you in the next one. See you later.